It has been just over a year now, starting December 2019, when the world learned about the virus that was causing severe respiratory illness and death in Wuhan, China. The virus was soon identified as SARS-CoV-2, responsible for COVID-19 disease. In early January 2020, it became evident that this deadly virus was making its way around the globe as increasing number of cases began to appear outside of China. Healthcare workers around the world found themselves strangers in a strange land, battling a new and deadly disease. We here in the Federation did not wait until it reached our shores to begin our preparations. We began a robust education program in January last year for all levels of healthcare workers so that they could be educated on the new viral disease, COVID-19. When it was declared a pandemic by the World Health Organization in March 2020, we were well prepared to confront the challenges. We followed the science and the advice of the World Health Organization and other reputable institutions like the Center for Disease Control, the Pan American Health Organization, and CARPHA. The recommendations were that all countries should increase their level of preparedness and response to identify, manage, and care for new cases of COVID-19, that countries should prepare to respond to different public health scenarios, cognizant of the fact that there was no one-size-fits-all approach in managing the outbreak of COVID-19, and that each country should assess its risk and rapidly implement the necessary measures at the appropriate scale to reduce both COVID-19 transmission and economic, public, and social impacts. We knew then from very early that there were tough decisions to be made and that we needed to strike a delicate balance between the containment of the virus and the socioeconomic impact from the containment measures, lives and livelihood. But in all decisions, saving lives must take precedence. That is why, for example, we were one of the first to turn back cruise ships in early March 2020 that we thought posed a significant risk of importation of the virus, while other Caribbean countries were still accepting them. We developed a strategy of preparedness and response plan to COVID-19 with the aims to slow and stop transmission, thereby preventing outbreaks, provide optimal care for all patients, especially the seriously ill, and minimize the impact of the epidemic on health systems, social services, and economic activity. Our approach was one of a whole of society approach to support preparedness and response, calling on everyone and every sector of society to play a role. The government injected $16 million into our health system to bring us into a state of readiness to fight COVID-19. We took a number of important decisions that got us to where we are today. The pandemic was declared a national emergency, and the National Emergency Operating Center was activated to address it under our chair, Mr. Abdi Samuel. The Health Emergency Operating Center was activated, and our team met on a regular basis, virtually and in person, to address the crisis, headed by Dr. Hazel Law as our CMO. We sensitized the public to their active role in the response and stressed the importance of personal responsibility in this fight. We kept you informed with regular public service announcements, press conferences, and filmed educational interviews on COVID-19 using every media outlet at our disposal. In addition to health worker education, we took the educational activity across the Federation to every school, major businesses, nursing care institutions, and the prison. A helpline was set up to address the public's concerns and was operational 24/7 in the early days of the pandemic, when not much was known by the public about the virus and there was widespread panic. We enhanced our hospital and community preparedness plan to ensure that space, staffing, and supplies were adequate for a surge in patient care needs. We prepared an infectious disease control manual that informed healthcare personnel at the institutions with protocols in dealing with every aspect of the COVID-19 patient, including handling the dead. We made structural changes to the emergency room at our main hospital, physically separating the treatment section for patients with flu-like illnesses from those with other medical emergencies. We augmented our staff at the emergency room by adding 7 extra doctors from our resident pool and brought in help from outside. 30 specialist nurses and 4 critical care specialist doctors were brought into the Federation from Cuba. 25 of these nurses were deployed in St Kitts along with 3 of the critical care specialists. The others were deployed to Nevis. We are currently looking to extend their contracts to assist with mass immunization against COVID-19, which is on the near horizon. The Josephine France Hospital was identified as the institution that would house patients with COVID-19, and the private ward with 15 single rooms is the ward being used, with a plan to command more of the hospital if needs be. The other institutions, Mary Charles and Poxon, were also placed in a state of preparedness. All of our health centers were in a state of readiness, and the schedules were rearranged so persons with flu-like illness would be seen in the afternoons, while persons with chronic illnesses were seen in the mornings to reduce exposure. All of the preparations made in St. Kitts were mirrored on our sister isle, Nevis. We were also continually monitoring the market for new approved products to aid in the fight, be it laboratory diagnostics, therapeutics, and vaccine. We increased our equipment and supplies with the purchase of additional ventilators, infrared thermometers, PPEs, nebulizers, portable X-ray machines, defibrillators, and new ambulances. We continually assess where we were and the effectiveness of what we had accomplished and use that information to plan future preparedness and response activities. We attempted to keep the virus at bay for as long as possible, but warned that it was only a matter of time before it reached our shores. We saw cases rise in major first world countries and around Caribbean neighbors, yet the Federation remained one of the few nations with 0 cases for an extended period of time. We were one of the last places on the face of the earth to have the virus cross its borders. When our first imported case arrived on the 25th of March last year, I remember the wave of panic that hit the nation. This was at a time in the disease history where not much was known, there was no effective treatment, and the death toll was climbing across the globe. We sought to calm the nation, but yet make persons aware of the magnitude of the challenge we face through daily COVID-19 briefings. The entire nation tuned in every day at 5 p.m. to hear the latest updates. We closed our borders in a timely manner on the 25th of March 2020 to curb the number of imported cases so that we would not overwhelm our health system, so-called flattening the curve. Prior to the closure of our borders, those who could leave, left. I remember sitting in one of the early meetings with Prime Minister Harris and other cabinet members discussing the challenges we face. The mood in the room was very somber. There are a few words from that meeting that PM said that resonate with me even today, and I quote, "All we have now is us. All we have is us. There is no one else who's coming to help us, and we have to do everything within our power to survive this pandemic." Those few words express the enormity and severity of the task we had at hand as a nation. For us, it was an urgent call to action, and we all set to work. We started a robust testing, isolation, and quarantine program. We ensured that all who needed to be tested were tested using the gold standard PCR test, and isolated all positive patients and quarantined anyone with a potential exposure. To date, we have tested 7,923 persons with 39 positive, a positivity rate of 0.5%, which puts us way below the 5% threshold that the World Health Organization asks countries to aim for as an index of control of the disease. I am happy that we were able to move from the dependency on CAFA in Trinidad for our testing with the development of reliable local testing capacity through next-gen laboratories. We were therefore able to get results in a timely manner and make informed decisions re isolation and quarantine. We will soon see an expansion of our testing capacity with the gold standard PCR test as the Josephine France Hospital, Avalon, and Quality Diagnostics come on board. We knew that it was only through strict adherence to science that we could succeed, and we kept this at the core of every decision we made. The protocols imposed with regards to COVID-19 were without exception across the board. You were quarantined or isolated if you needed to be, whether you were friend, family, or foe, royal or commoner. We imposed a national lockdown and curfews to contain the virus, and we were one of the few nations to avoid community spread to date. Though we were criticized for a 14-day quarantine, while some countries chose to not to quarantine or had a much limited quarantine period, we stuck to what we believed, backed by scientific evidence. We mandated the use of the gold standard PCR tests and ignored calls to use less reliable antibody and antigen tests. We have since seen what has happened to other countries that chose less stringent protocols. While initially they appeared to be making progress with the opening up of their economies, many are now returning to nationwide lockdowns and curfews. Time has proven that our early decisions were correct, and many countries are now introducing measures we had in place for some time now as they attempt to return their horses to the stables. We did not, however, just lock ourselves in the basement and await for the passage of the pandemic, but attempted to move slowly back to some sense of normalcy internally. We successfully held constitutionally due elections during this period, ensuring that every citizen exercised their right to vote while abiding by COVID-19 protocols to prevent spread. We slowly reopened our country internally and saw the reopening of churches, schools, the manufacturing industry, restaurants, and the return of sporting events. We provided protocols for event organizers so events could be held safely during the pandemic. Throughout all of this, we kept the viral reproductive number way below 1, meaning that we prevented one person from infecting another, thus avoiding clusters and community spread. On the 31st of October 2020, we reopened our borders to international travel and warned that the virus would soon return. We made an early decision to exit the proposed Caribbean bubble to protect our people, as other countries in the bubble had less stringent entry protocols. Time proved that this was a correct decision, as some of those countries are now experiencing community spread. We have seen an increase in the number of imported cases since the opening of our borders, which was inevitable, but have successfully contained all the imported cases. We still were able to show the world that in the middle of a pandemic, we can safely host a carnival, and had a successful virtual Sugar Mass 49 under the chair of Shannon Hawley. We have seen success at containing this virus with the prescription of non-pharmaceuticals, social distancing, wearing a mask, hand sanitizing, and proper cough etiquette. Because of the personal responsibility assumed by most, if not all of our citizens, we have contained the virus thus far with no major hospitalizations and as yet no deaths, despite the fact that globally there are over 2.2 million deaths, and over 440,000 deaths in the United States. Of note, January was the deadliest month in the USA since the pandemic, with over 95,000 persons dead, equivalent to one person dying every 30 seconds for the entire month of January. The success of this little federation in managing COVID-19 has caused us to be recognized internationally as the country with the lowest rate of confirmed COVID-19 cases and having the lowest COVID-19 risk in the hemisphere. I commend the leadership, starting with our PM, for getting us this far, but it would not have been possible without the cooperation of you, the public, and the personal sacrifices many had to endure along this path. Tonight, I want to say thanks to each and every one of you who made an effort in this fight. The crisis is, however, not over. The war against the virus is not done. We can lose all the gains we have made tomorrow if we lapse into complacency and succumb to COVID fatigue. With new and contagious strains emerging, we need to be even more vigilant. Our plan was to hold strain until the vaccine arrived. We have been successful thus far in reaching this goal. There are now a number of vaccines available with very good efficacy at preventing severe disease and death. We have all made personal sacrifices in the successful fight thus far against this deadly virus. And of course, some made greater sacrifices than others. We thank the Almighty God, however, that of the 2.2 million deaths globally, none were from the Federation of St Kitts and Nevis. Let us continue the fight. I thank you.
And I thank you, Dr.